Have you had a skin rash or an acne that came out of nowhere? No new soap, no new food you could identify, nothing really obvious, and then it just disappeared on its own after a few days. Woken up with a joint pain in your knees or fingers for no clear reason, or gone through periods where your brain just doesn't work. It's a bit foggy, slow, and can't concentrate, even when you have slept fine. All of us see skin as a skin problem, joint as a joint problem, brain fog is a stress or a sleep issue. They get treated separately or ignored. But what if I tell you if all of them could have the same underlying cause? So, in my last episode, we spoke about farts and we kind of connected it to the gut health. We talked about fiber, protein, bacteria, and something called as LPS, if you remember, that can actually cross into your bloodstream when your gut wall is compromised. So, today we go a little deeper. We're going to go into leaky gut. What it actually is at a cellular level, what happens when the gut contents enter your bloodstream, how your immune system reacts and responds, and why that response can, in some cases, end up attacking your own body pretty rarely. Okay, so as a table of contents, this is what I'm going to cover. So people are already can at least form an opinion if they want to continue or not. We're going to have about 7 sections. Number 1 is what is a gut wall and how it is supposed to work. Number 2 will be what leaky gut means at a cellular level. Then we'll talk about what escapes when it leaks and why your immune system has never been trained to deal with it. How that immune response becomes a systemic inflammation and where in your body it typically shows up. Then we'll talk about the autoimmune connection, molecular mimicry, and why your immune system starts attacking the wrong targets, that is your own body. Then we'll also speak about how we can test for a leaky gut, and finally what actually heals it and what kind of realistic timeline we are looking at. So let's get started. Section number 1. The gut wall, what is it and what it is supposed to do? Let's start with the basics. I mean, we covered it in my previous episode, but I'll just quickly run through it. Let's start with the structure. Most people have no mental model of what the gut wall actually is, so we'll do that very quickly. Your intestinal wall is a single layer of epithelial cells called colonocytes. I'll repeat, colonocytes. Just one cell thick, that's it. The entire barrier between your gut contents, that is what you eat and what is present inside the gut, and your bloodstream, that wall is just one cell thick or deep. Think about that. On one side, you have partially digested food, you have bacteria, bacterial toxins, fragments, and waste compounds. On the other side, the bloodstream, which goes everywhere, your brain, your heart, your joints, your skin, the only thing separating these two worlds is a single layer of cells. So once you have that imagery in your mind, you will be able to follow this much better. Now these cells, the single layer of cells, are packed very tightly together, held in place by proteins called tight junctions. It's called tight junctions. Think of them like a grout between the tiles. Very easy to kind of picture as you look at your floor. You have occludin, caudin, ZO-1. These proteins form the seal. They control what can cross and what can't. Now, when the gut wall lets through digested nutrients, acids from protein, fatty acids from fat, glucose from carbohydrates, that's what it will typically let through. Vitamins, minerals, water, etc. The wall opens selectively to let these nutrients through and closes immediately thereafter. It's like, okay, I know all of these people. I can allow you to pass through the wall. Rest of the stuff cannot move. What the gut wall is supposed to keep out? Bacteria, bacterial remnants, toxins, undigested food particles, waste compounds. These are never supposed to enter your bloodstream ever. Now, alongside these colonocytes, your gut wall is also home to 70% of your immune system. Imagine your immune system as your soldiers guarding your palace or your house. These are called as GALT, G-A-L-T, gut-associated lymphoid tissue. Gut-associated lymphoid tissue. It's sitting right there on the bloodstream side of the wall. So we discussed the wall on this side. That's one cell thick wall. On the left side, we know what all is there: bacteria, remnants, undigested food particles, etc., and the nutrients. On the other side of the wall, the soldiers are standing. That is your GALT, or your 70% of your immune system. When the wall is intact and functioning well, it sees only clean, processed nutrients that were supposed to flow. It stays calm. The soldiers are quiet, watching their movies and relaxing, just like you. The whole system is elegantly designed, selective, efficient, and protective. It works brilliantly as long as the wall stays intact. Now, with that basic being established in terms of physiology, we move into section 2, what leaky gut actually is. Leaky gut, the clinical term for it is intestinal permeability. It's what happens when those tight junctions, you remember the grout between the tiles, between the colonocyte, they start to loosen and fail. There's a crack in the wall that causes seepages. The cells themselves aren't dying, the seal between them is weakening. Gaps open up, and through these gaps, things start crossing that were never supposed to. So we have these foreign objects which are going to go into the bloodstream. Now, what causes these tight junctions to open is a question that you will have, at least I had. There are several things, and most of them are modern lifestyle factors. We'll quickly cover some of them and then go to the next section. Number one, chronic dysbiosis. When your gut bacteria shift from fiber fermentation to protein putrefaction, this is something that I covered as part of the fourth episode. The PCFAS and hydrogen sulfide produced during protein fermentation are directly cytotoxic or to the colonocytes. That is, like, it is poisonous to your colonocytes. They damage the cells and starve them of butyrate, the compound that normally fuels and repairs the gut wall. So now you have a double whammy, right? You have the damage plus there's no means to repair it. The next point is chronic stress. Cortisol directly increases intestinal permeability. The gut-brain axis runs both ways. When your brain is under sustained stress, it signals the gut to loosen the barrier. It has evolutionary mechanism for why it is doing it. In a genuine emergency, you want the nutrients to be absorbed fast, but chronic stress keeps the signal permanently on and the gut wall pays the price. Lack of good sleep also contributes to this. Number 3, NSAIDs, non-steroidal anti-inflammatory drugs. Brufen, Flexon, Combiphlam, Voveron, extremely commonly used. These inhibit prostaglandins, which are part of the gut's lining protective mechanism. So the gut lining's protective mechanism gets compromised a bit. Regular NSAIDs usage is one of the most documented cases of increased intestinal permeability. Many people taking these for joint pain or headaches are unknowingly making their gut wall worse. Number 4, alcohol directly dissolves the protective mucus layer that sits over the gut wall and increases tight junction permeability acutely. Even moderate drinking, if it's regular, keeps gut permeability elevated. So you have to be careful. Then we go to the next one, number 5, ultra-processed food. Very common. Emulsifiers commonly used in processed food have been shown to degrade gut's mucus layer and disrupt the tight junction proteins. The food ingredient list is worth reading. I'll just quickly call it out. Carboxymethylcellulose, CMC, cellulose gum or polysorbate 80. If you find these on the ingredient panel, be a little careful. Now, a word of caution. Generally in the US, whatever they call us, generally recognized as safe. So these ingredients have been still called in the US and approved by FSSA in India as generally safe, since the regulatory bodies have not found existing evidence sufficient enough to reverse their approval. It is not settled that this translates into a disease at a typical dietary level, but it's a legitimate enough signal or a concern that you need to read labels and moderate the intake of food that contains these emulsifiers. Okay, cool. The last one, antibiotics. Again, very common use cases, disrupts the microbiome, reduces the short chain fatty acids production, which we spoke about in the last session, reduce butyrate availability to fuel the colonocytes. The gut wall then weakens when the bacteria feeding it are gone. Now, here's what matters. Most people aren't dealing with one of these 7 conditions that I mentioned. They're dealing with many of them simultaneously. Chronic stress, occasional use of NSAIDs, regular alcohol, processed food on a regular basis, a lot of antibiotics. The cumulative load on the gut is much higher than any single factor that we listed. So that's the end of section 2. So let's go into what is going to escape this compromised wall and why the immune system fires. So once the tight junctions loosen, what actually gets through and why does it cause such a significant immune response? Let's look at it. Number 1, LPS, I think I touched upon it during the introduction, lipopolysaccharides, is a molecule that forms the outer wall of a certain bacteria living in your colon. Under normal conditions, LPS stays in the gut where it is supposed to live. The wall keeps it out. When it leaks into the bloodstream, it triggers what is arguably the most aggressive immune response your body can generate. Your immune system evolved to treat LPS in the blood as a signal that the bacteria have breached your defenses. That is, you're under attack, the bacterial attack. So it has to respond accordingly. The soldiers have now become very, very active, hyperactive. Even tiny amounts of LPS in the bloodstream can cause significant inflammatory activation. This is not an overreaction. This is exactly what the immune system was designed to do. The problem is that the gut wall was supposed to prevent LPS from getting into the bloodstream. The immune system never learned to learn tolerance for it because it was never supposed to encounter it in the first place. What else can cross apart from LPS? Bacterial fragments, not whole live bacteria, usually fragments of dead bacterial cell walls, still triggers the immune response because your immune system cannot distinguish between a live bacteria and bacterial fragment. Both are read as threat and treated as one. Nice, it's raining behind me. Isn't it beautiful? Now, number 3, undigested food particles. A small intestine breaks protein into individual amino acids before absorption. Small, harmless, recognized molecules. But when partially digested protein chains cross a leaky gut, your immune system has no reference for them. They are not something it was trained to tolerate, they are foreign. It builds antibodies against them. Now, this is one mechanism behind food sensitivities that people develop in adulthood. Repeated leakage of the same food particle trains the immune system to react to it. The food actually hasn't changed, your gut wall and immunity has. Now, one of the questions I had, and which you might actually have, is why hasn't the immune system been trained to tolerate these things? I mean, repeatedly you're encountering some of these items. Why can't you kill them all? Good question. This is the key insight. During early development, that is when you were a child or when you were very young, your immune system goes through a training process, just like all of us go through training in the companies. Learning what is self, like what belongs to me, that is safe, what is foreign and dangerous. So self is safe, foreign is dangerous. LPS in this bloodstream was never encountered during the training because the gut wall was always intact. Your body never needed to develop tolerance for it. It wasn't supposed to ever come. So when the gut wall fails and these compounds start appearing in the blood, your immune system is taken aback. It responds with full force. It's not malfunctioning. It is doing exactly what it was designed or programmed to do when you were a child or when you were very young. The failure is the gut wall, not your immune system or immunity. Now, when the immune system fires, this gets interesting. Cytokines are released. What are cytokines? They are inflammatory signaling molecules. These enter the circulation, that is, they have now entered the blood. They travel all over the body. And this is where the story becomes a thriller. From the gut problem to a whole body problem. If the trailer was interesting, now watch out for the climax. Section number 4. Now, where does the inflammation go? Now, the cytokines are getting released. Let's go organ by organ. Your immune system has a concept I want you to hold on to called as a threat budget. When it's activated by LPS and bacterial fragments in the blood, it broadcasts a distress signal called cytokines that puts every part of the body on alert. So the soldiers have immediately been on alert, like in the previous section, and they are alerting every organ in the body saying, hey, something is wrong. We are under siege. We are under attack. Be ready. Be ready. Now, where that alert causes visible damage depends on your individual genetic vulnerabilities and predisposition, where existing inflammation already is and how long the leak has been going. So there are 3 multiple angles here. It depends on your individual genetic vulnerability and predisposition. Number 2 is where your existing inflammation already is residing and how long the leak has been happening in your gut. Now, the root cause is the same. The different effects will be felt in different parts of the body. Let's walk through them. Number 1, skin. The skin is often the first place a leaky gut inflammation shows up visibly. I think it's a wonderful design. We'll walk through it. Circulating LPS activates mast cells, immune cells residing in your skin tissue. Mast cells release something called as histamine. Histamine causes local vasodilation, redness, swelling, and itching. This is the mechanism behind inflammatory skin conditions like eczema, psoriasis, acne, boils, etc. All have documented connections to gut permeability. The sudden rash that appears for no obvious reason, no new food, no new soap, no new towel, maybe a gut leakage event expressing itself on the skin. A day or 2 later, the rash disappears. The gut stabilizes. LPS load drops, mast cells also calm down, they stop screaming. The person never is able to connect the 2 events. That's the interesting part. Now, through food experimentation, I have actually figured out, which I will talk about it in much later section. The gut-skin axis, which is it's a legitimate research field right now. Dermatologists are beginning to look upstream at the gut permeability when treating chronic skin conditions that don't respond to topical treatment, like, the treatment that you apply on the skin. If it doesn't result in any, let's say, relief, people are now beginning to look at if it's a possibility due to gut dysbiosis or issues in the gut. The cream only addresses the symptom, the gut possibly is a cause. Next is joints after skin. Circulating inflammatory cytokines deposit in joint synovial tissue, a fluid fill the lining of the joints. This is the mechanism behind inflammatory arthritis. It is also why people with chronic gut dysbiosis often report unexplained joint aches, knees, fingers, lower back. The joints aren't injured, they are downstream recipients of a circulating inflammation. The joint pain is real, the origin again is in the gut. The third organ, brain. The gut brain axis, something all of you are aware of. Let's see what happens here. The blood brain barrier is semi permeable. LPS and inflammatory cytokines can cross it. Not easily, but under sustained inflammatory load, enough can get through. Microglia or microglia, I don't know what's the right pronunciation, microglia. The brain's immune cells are activated. This is called as neuroinflammation. Brain fog, difficulty concentrating, low mood, fatigue that sleep doesn't fix, a general cognitive heaviness that you can't really explain why it's happening. Now, there is a strong research linking gut dysbiosis to depression and anxiety, and we'll talk about that. Not just correlation, but a proposed mechanism through exactly this gut-brain axis or pathway. Additionally, approximately 90% of your body's serotonin, you must have heard about serotonin, the happiness hormone, is produced in the gut by enterochromaffin. I'll repeat it, enterochromaffin. Cells heavily influenced by gut bacteria. A depleted dysbiotic gut produces less serotonin, signaling upward. The mood consequences are real and measurable. Everything absorbed from the gut first goes to the liver via the portal vein, including the leaked LPS. The liver is actually the first organ to encounter gut leakage before everybody else. Kupffer cells, the liver's resident immune cells, deal with LPS constantly when gut permeability is high. Chronic LPS exposure to the liver is now linked to non-alcoholic fatty liver disease. All of you would have heard about fatty liver. One is alcohol-induced, the other one is non-alcohol-induced. So this can potentially cause non-alcoholic fatty liver disease, even in people who don't drink. The liver is taking a severe hit because it was not designed to take it chronically. When your doctor says your liver enzymes are slightly elevated and your diet seems fine, it is worth considering as a variable. The next organ, blood vessels and heart. Chronic systemic inflammation damages the endothelium, the lining of the blood vessels. Inflamed arterial walls accumulate plaque more easily and readily. This is why chronic inflammation is now understood as a core driver of cardiovascular diseases, not just cholesterol, but the inflammatory environment that makes cholesterol dangerous. A chronically leaky gut producing sustained LPS load into circulation is a chronic inflammatory driver. The cardiovascular implications are not immediate, but they compound over years. You will not know about it in the near term, but it may cause a damage over a long time. Get that right. Now, one of the questions you might have is we covered brain, skin, let's say cartilage or bones, etc., right? Bone pain, and then we spoke about damages to the blood walls and heart. Now, where is it likely to show up more often is a question that you might have. What percentage of leaky gut systemic inflammation shows up on the skin? Now, I think skin is an easy thing for all of us to quickly verify if something is changing, because we look at ourselves almost every day. We take bath, we are naked, we are looking at ourselves in the mirror all the time. So it's kind of easier to see. I think God designed skin as a way to kind of reflect what is going on inside. Okay, there's no single clean number because leaky gut is not formally diagnosed at a population scale yet through research, but here's what the research gives us. Approximately 60 to 70% patients with inflammatory skin conditions like eczema, psoriasis, etc. show measurable markers of increased intestinal permeability when tested. That's the reverse angle. Of people who already have skin issues, most of them have a gut component. It's a correlation. From the other direction, of people with confirmed gut dysbiosis or IBD. Now, what is IBD? Inflammatory bowel disease. Around 25 to 40% develop skin manifestations at some point. Dermatologists have a term for this, extraintestinal manifestations. It's called extraintestinal manifestations. In Crohn's disease and ulcerative colitis, specifically, skin involvement is one of the most common extraintestinal findings. Now, what is IBD? Just for completeness sake, it is an autoimmune disease, causes visible mucosal damage and shows up on blood work and colonoscopy. Now, the skin is not universal, but the most frequent external signal. Roughly 1 in 3 to 1 in 4 people with significant gut inflammation will show it on their skin at some point. Why does the skin cope first before other organs? That's the interesting part. Skin seems to be an early signal for several reasons. It is visible, like I just mentioned, brain fog, joint aches, liver stress. These are felt but not seen. A skin rash is seen immediately, so skin may not be the first organ affected. It is just the first one noticed. God wants you to notice it. It's the most accessible immune battleground. The skin has the highest density of mast cells relative to tissue volume of any organ in the body. The mast cells are sensitized quickly by circulating LPS and cytokines. They respond very fast within hours to days of an LPS spike. Other organs respond very, very slowly. The next point is lower activation threshold. Skin mast cells respond to lower concentrations of circulating inflammatory compounds than, say, joint, synovial tissues or brain microglia. Think of it as a more sensitive alarm. It goes off much earlier. So the alarm is much more sensitive, so they can signal you much earlier than the other organs. The fourth point about skin is rapid turnover. Skin cells turn over every 2 to 4 weeks. This rapid renewal means inflammatory signals expresses quickly and visibly in the skin. Slower turnover tissues like cartilage or nerve myelin takes much longer to show damage. Now, I told you about some personal experience that I'll share few minutes back. I'll just quickly touch upon that. So from my personal experience in the last, I would say about 6-7 months of understanding my own body, the gut, let's say the axis and what kind of food suits me, what kind of food doesn't. I figured that whenever I've eaten out in hotels continuously for more than 2 days, and if it's slightly carb loaded, and in both these occasions, when I went to Chennai and once I went to Aircard with my friends, it was more of a typical idli, rice, dosa, pongal, vada, sambars, and those kind of items that I've had. Every time I've had that, I've had a couple of skin related inflammations. It could be a small boil on the cheek or maybe on the nose or sometimes on the forehead. They've been quite random, and I've seen after a few days they just vanish on their own. I do think that it could be a possible correlation with what we are discussing. So how do I test it now? The only way is not by eating it outside for a few days to see that they will vanish. And secondly, when I go outside next time, I should be more careful in terms of what I eat versus what I avoid. Let's try it out. Just thought I'll share my own personal experience. Okay, over to section number 5. Now we've discussed a lot of interesting data. We've discussed what organ is affected and why. Let's look at the autoimmune connection, the extreme cases when the immune system starts attacking yourself. That's a very bad situation to be in. Unfortunately, it happens to some people. There are multiple factors. Let's understand that part. Cool. What is an autoimmune disease? It's pretty clear. When the immune system is chronically activated by foreign particles in the bloodstream, it does 2 things over time. It gets better at attacking these specific particles. I mean, they are learning and training to attack. They build antibodies and build immune memory. And it starts making errors. Yeah, just like programming errors. Why does it happen? It is because of molecular mimicry, the case of mistaken identity. Some of the particles leaking through your compromised gut wall, food protein fragments, bacterial fragments, look structurally similar to the proteins in your own body. The immune system, trained over months to attack the leaked particle, starts cross-reacting with the body's own tissue that shares a similar molecular structure. This is a case of molecular mimicry, and it's one of the most compelling proposed mechanisms for autoimmune conditions. Let's look at a few use cases. I'll not go deep into every possible autoimmune condition now. I'm not an expert in it. Number 1, Hashimoto's thyroiditis. The thyroid protein thyroglobulin shares structural similarity with certain dietary proteins that can leak through the compromised gut. The immune system attacks your thyroid gland. Number 2, rheumatoid arthritis. Joint tissue proteins share structural similarity with certain bacterial fragments. Chronic gut leakage trains the immune system to attack them. The joints become the target. Beta cells that produce the insulin share structural similarity with certain food proteins, particularly from cow's milk. Early gut permeability in infancy is now being studied as a potential contributing factor in genetically susceptible individuals. Number 4, multiple sclerosis. Elevated zonulin levels, which is a marker of gut permeability, we'll cover that later, have been consistently found in MS patients, that is multiple sclerosis patients. The myelin sheath protecting your nerve cells share structural features with certain bacterial proteins. Now, I want to be very careful here. All these are correlations, and correlation is not causation. These are proposed mechanisms, hypotheses, not proven causes. Autoimmune disease is multifactorial. Genetics play a major role. Not everyone with a leaky gut will develop autoimmune disease, but the pattern is consistent enough and across multiple conditions that researchers are now starting to take it very, very seriously. The gut is upstream of the immune system. When the gut barrier fails chronically, the immune system operates in an environment that it was never designed for, and errors start accumulating rapidly. Now, the immune system didn't make a mistake. I want people to understand this. It actually did what it was trained to do, that is, attack any foreign particles. The training data was corrupted by the gut wall that stopped doing its job because of our bad lifestyle. We spoke about what are the conditions for developing autoimmune disease. So there is a bit of good news and bad news, but we'll just cover the necessary conditions for anyone to develop autoimmune disease. For autoimmune to happen, three things must converge. Genetic susceptibility, number one. Genetic susceptibility. Yeah. Number two, a trigger. Number three, increased intestinal permeability. So all of these things must occur for you to develop autoimmune disease. Remove any of these three and autoimmune diseases don't develop. Most people don't have the genetic susceptibility. But here's the thing. You don't know your HLA profile. Most people have never been tested. Even I have never done it, and nobody typically does till they start seeing some conditions or some symptoms. What everyone with chronic leaky gut does get, regardless of genetics, is systemic inflammation. This is a common factor for everyone. Everyone will have gut inflammation. There's no escaping it. Fatigue, brain fog, skin flares that we discussed, joint aches, metabolic disruptions. These are the universal consequences. Autoimmune disease is the serious end of the spectrum. It's the extreme case. The consequence for people who are genetically positioned for it, unfortunately, and also whose gut leaks long enough, a very long duration. Now, there's an argument from Fasano. He says he's one of the leading gut permeability researchers in the world. He says that the leaky gut may be a prerequisite for autoimmune disease, not just a side effect of it. So this is a very interesting finding. So he says, fix the gut wall and you may be removing one of the three legs that the disease need to stand on. This is not a cure, but it's a meaningful intervention. So that's section number 5. That's a wrap. Let's go into section 6. How do you know if you have it, right? I know you've been waiting for it. Let's look at it. The honest answer, the symptom pattern is often more reliable than the test. So we will cover two sections here, subsections. The symptom patterns that we discussed and what are the tests that you can potentially do. So let's start with the symptom patterns. Persistent bloating, gas, irregular digestion, food sensitivities that suddenly developed in adulthood, foods that you ate without issue for years, but now they cause some reactions. Chronic fatigue that sleep is not able to fix, brain fogs, skin conditions that flare and recede without a clear trigger, joint aches without injury, mood instability, frequent low-grade illnesses. Now, none of these alone means leaky gut, but several together, especially if they develop gradually over months or years alongside a diet low in fiber, high in processed food, with chronic stress, is a recognizable pattern that you should watch out for. I also want you to understand this. Not every skin problem is a gut problem. A fungal infection is a fungal infection. A sunburn is a sunburn. Contact dermatitis from your soap is contact dermatitis. But when the skin issue is inflammatory, chronic, treatment resistant, keeps coming back despite topical interventions, and comes packaged with other systemic symptoms like bloating, brain fog, etc., or joint pain or fatigue, the causes may not be in your skin. It may be upstream, that is your gut. So that's something that you should remember. Now ask yourself these questions. Is it inflammatory? Is it chronic and treatment resistant? Does it come with other systemic symptoms that we discussed? Does it correlate in time with gut events? Obviously, most of you kind of remember what you ate, when you ate. So there are some patterns, like I mentioned about my outside visits to certain cities when I ate outside food and developed some skin rashes. It could be one of those possible situations that you could watch out for. Now, this is on the symptom patterns, which is more reliable. Let's look at some of the tests that can possibly reveal that if you have some autoimmune conditions. There are two main options for you to test. The number one is lactulose mannitol urine test. I'll repeat it. Lactulose mannitol urine test. Consider the research gold standard. You drink a solution containing 2 sugars, then collect urine for several hours, and we'll find out what happens. Lactulose is a large molecule that should not cross the intact gut wall. So look at the test that is designed beautifully. You drink both lactulose and mannitol. Now, lactulose is a large molecule that should not cross that one cell wall where the other side soldiers are present. Mannitol is small and can cross easily. The ratio of the two in your urine tells how permeable your gut wall is. Pretty self-evident and very clear, logical. High lactulose relative to mannitol means the wall is leaking. This is the test number one. What's the other option? The zonulin blood test. We discussed about zonulin, right? Now, zonulin is a protein that regulates the tight junction. The grouts, it has to maintain those things properly. Elevated zonulin in the blood suggests that the tight junctions are signaled to open more than they should. This test is more accessible and more commonly used in practice, but has some reliability limitations. Commercial zonulin assays vary in accuracy and levels naturally fluctuate. It should be interpreted alongside the symptoms and other markers, not in isolation. So that is something that you should remember, but I'm just giving you all possible options to test. If you have something, your doctor will prescribe something better than what I can do. One important caveat from there, even the best tests capture only a slice of gut barrier function. A knowledgeable clinician looking at your full symptom picture, diet history and inflammatory markers will often get further than a single test result. If you have the typical symptom patterns, it's reasonable to address gut leak directly without waiting for a confirmed test result. Most people actually improve with gut supportive diet and lifestyle changes regardless. I want you to remember this. Now we go into the last section, what actually heals it. We've had a very interesting deep discussion for the last 35-36 minutes. Now let's just stay with me. This is very important. What will actually heal it and what kind of timeline are we looking at? Let's look at that quickly. The gut, I want you to remember the biology here. The gut lining regenerates 5 to 7 days, just like skin cells regenerate or most cells in your body regenerate every few days, depending on the organ. The gut lining also regenerates every 5 to 7 days. Every week, your colonocytes are replaced with new ones. This is the good news, but it means the gut wall, it basically means the gut wall has genuine repair capacity. The question is whether these conditions for repair are present or whether the same damaging inputs keep hitting the freshly regenerated cells. Now, this is kind of very logical, isn't it? The cell is saying, okay, now I've been damaged, let me repair myself, I'll get back. But if you continuously bombard with bombs or inflammatory markers, or you do something wrong, or the stuff that we discussed in section 2, alcohol, stress, lack of sleep, processed food, etc. If you continue to do the same bad things, again the cells will get damaged. So this is a never-ending cycle. Healing leaky gut is not about one supplement or one food. It's all about systematically removing what's damaging the wall and also providing what will repair it. So not only you have to stop taking things that will damage the gut, you will also start taking things that will repair the gut and make it better. So we will discuss that now. What are those? Ultra processed food and emulsifiers. We already discussed it, so I'll just cover the high level stuff. Ultra processed food, emulsifiers. Chronic NSAID use. Number 3, alcohol. Moderate regular consumption keeps gut permeability elevated. Reduction has measurable impact on permeability markers within weeks. So keep it under control or moderation. Chronic stress. Cortisol directly increases permeability. Stress management is not a soft advice here. It's a direct intervention on gut wall function. Sleep, exercise, meditation, socializing, whatever your effective regulation practices, it all counts. So these are 4 main reasons, things that you should avoid. Now let's also look at what will repair and nourish your colonocytes. Fiber, we discussed in the last episode. Fiber fermentation produces butyrate, which is the primary fuel for your gut lining. You cannot repair a wall while starving the cells that build it. 30 grams of fiber a day from diverse plant sources, dal, rajma, sabji, fruits, whole grains, build the foundation very strong. Number 2, fermented foods, very, very important. 2025 analysis of 41 randomized clinical trials found significant improvements in gut permeability markers with probiotic and prebiotic interventions. Dahi, kanji, fermented pickles, whatever you like. These are just not tradition. They are introducing beneficial bacterial species that support tight junction integrity and short chain fatty acid production, which are good for your colonocytes. Even a small daily serving has measurable effect. So I want to touch upon fermented foods along with fiber. So recently I read this on X, right? Somebody had posted, I forgot who it was. He said they did a study and they figured that fermented foods had better impact on your gut and microbiome and the gut wall compared to fiber. So make sure you take fermented foods often. Number 3, omega-3 fatty acids, fatty fish, flax seeds, walnuts, etc. known to improve intestinal barrier integrity, though to a lesser degree than short chain fatty acids. Anti-inflammatory effect on the tight junction proteins. Number 4, sleep. Very crucial. In all my podcasts, I've always said sleep, number 1 for good health. The gut lining repairs itself during sleep. Chronic sleep deprivation keeps inflammatory markers elevated and compromises repair. 7 to 8 hours is not a wellness recommendation, it is gut wall maintenance necessity. So sleep well. Now, let's look at timeline, honest expectations, right? I don't want to be a quack and telling you it will heal within a day or a week. The intestinal lining regenerates 5 to 7 days. We already discussed it, but a chronically inflamed gut may take 3 months to 12 months to show meaningful improvement in permeability markers, and complex cases with underlying autoimmune conditions can take up to 2 years. Symptoms often improve long before the gut wall is fully repaired, so you don't have to wait for it to repair completely. You may notice less bloating, better energy, clearer skin within the first few weeks. The systemic inflammation takes longer to calm down, and some species of gut bacteria, once depleted, are very difficult to re-establish. So one of my friend used to take a lot of antibiotics few years back for some illness, and is completely devoid of, I think, about 7 or 8 types of microbiome in his stomach, right? And he's actually going through a treatment. So I discuss very often with him, and in fact, while doing this podcast, he gave me a lot of input. So you have to protect your microbiome diversity. I don't remember the exact number. It was about 22 to 30 different varieties. It's worth protecting. So kind of imagine, right? It's easy to maintain something rather than figuring a way to restore them by taking supplements or other kind of foods. It just makes it that much more difficult. So anyway, to summarize, there is no 2-week leaky gut cure. There is no shortcut. Anyone selling you something like that is selling you urgency, not science, because you've understood what really happens. You understand the basics of biology, gut, microbiome, bacteria, immunity, autoimmune, pretty much cytokines. We've kind of covered the basics. So it's a slow, steady, consistent work. The repair capacity is real. Your stomach has the capacity to heal. The inputs are known. The biology is on your side, as long as you stop hitting the wall with things that damage it. So that's about it. Now, a quick summary for people who just forwarded a lot of things. This will be about a minute. So we'll discuss about gut wall. It is 1 cell thick, just 1 cell thick, separating your gut contents from your bloodstream and your immune, the immune cells and every other organ downstream. When it holds, you absorb the nutrients cleanly. Your immune system is resting. The soldiers are quiet, happy, watching Netflix. Your bacteria produce compounds that heal and protect. When it starts failing, LPS enters your blood. Lipopolysaccharides, your immune system fires. They are overactive, inflammation starts circulating. Depending on where you're genetically vulnerable, your skin, joints, brain, liver, blood vessels, heart, it can be in multiple places, or your tissues become your own downstream targets. The causes are largely modern lifestyle, but mostly reversible. Chronic stress, low fiber, ultra-processed food, regular NSAIDs, alcohol, dysbiotic gut bacteria with nothing to ferment but protein. These are some possible causes. What is the repair mechanisms? Largely within control: fermented foods, polyphenols, sleep, stress management. Remove the damage, provide the fuel, give it a lot of time to heal. Your immune system is not the villain here. It's doing exactly what it was programmed and designed to do. The gut wall was supposed to do something, but it didn't do because of our lifestyle factors. Our job is to now give it what it needs to hold the line or the wall intact. Thank you so much. I'm Vinod. If this connected with something that you've been experiencing, start with the basics: more plants, less processed food, better sleep. Your gut wall regenerates every week. Give it the conditions to regenerate very well. I'll see you next week. Please share it with your friends and give me some appreciation if you like it. Maybe drop a comment or share it with someone or just put a like. Thank you so much. I'll see you soon.